Hey everyone, it's Dr. Hodges, and I have a little quick PSA for everyone. I was talking with a couple of my GLP-1 reps, both the Zepbound rep and my Wegovy rep. They're both delightful. Um, and we were talking about indications for injectables, but then also just about drug coverage in general. And there are a couple little updates and then for coverage, but then also I wanted specifically to talk to my patients that have Medicare and or a Medicare Advantage or replacement plan, how you might be able to get coverage. So for number one, the two medications that are covered by that might be covered by Medicare or your Advantage plan for the indication of weight loss would be Wegovy, which is semaglutide, and Zepbound, which is tirzepatide. They have, for Wegovy, there has been an added indication of cardiovascular disease, which is huge. And for Zepbound, there's the added indication for sleep apnea. And so these are other indications and diagnoses that we can use if you have it to help you get these medications, should these be a covered benefit with your insurance. Now, so that's number one. Number two, which is even bigger, and I'm going to show you guys how to look this up. So, have you heard of the Medicare prescription payment plan? This is what it is. I'm going to turn my little camera to my laptop screen. So Medicare has started a program. Oh my goodness. There we go. Medicare has started a program, and it is called the Medicare Payment Plan. And what is the Medicare Payment Plan? So anyone enrolled in a Part D plan can see about going on this payment plan for to help them with the cost of their drugs. So for instance, and then I'm going to come up here to search, and then I'm just going to say prescription payment plan, search. All right. And what is the prescription payment plan? So what it allows you to do is manage the out-of-pocket costs for your prescriptions. And this is the website, medicare.gov/prescription payment plan. Okay. So in a nutshell, what does this do for our patients? So, and the best time to really sign up for it is really right now. So like the first quarter, that way you can get the full advantage. So just to make the math easy, let's say your deductible is $1,200 and you have a Part D plan, which is what covers medications, or you're on a Medicare replacement plan that covers prescriptions for you. Let's say you have coverage for Wegovy, but the cost of the Wegovy is going to be $600 every time you go. Well, with Medicare, the most out of pocket that you can pay is going to be in a year is going to be $2,000. What the government has now done is set up this payment plan where you contact Medicare or you contact your Medicare replacement plan and tell them that you want to get set up on this prescription payment plan. And what they'll do is they'll take whatever that deductible is. To make the math easy, let's say it's $1,200 and let's say it's January. They will separate it out in 12 equal payments, which would be $100. So each month when you pay your premium for the Medicare, they'll also bill you the $100 for the prescription payment plan. So once you're officially signed up, that's what they'll do. And then when you go to your pharmacy to pick up your prescription, you won't pay your pharmacy anything. What they'll end up doing is, because they already see that you're signed up in this prescription payment plan and it doesn't cost you anything, provided that that is a covered medication on your particular plan. So instead of you having to cough up $600 either in the very beginning or every time you go up until $2,000 is met, if you sign up for this prescription payment plan, when you go to the pharmacy, it shouldn't cost you anything. It's just that you're going to be billed each month the full amount of your deductible. Does that kind of make sense? Now, it is now March when I'm doing this video. So it would be divided over March through the end of December. So it would be divided over 10 months. So you can see as your as the year progresses, the payments left available, the number of payments will be less. So that amount might be more that you would have to pay each month. But I really think this is a wonderful program for seniors and for patients that have these Medicare plans. So give them a call and see if you can get on this, especially if you, and this is not just for Wegovy, this is for any prescription. So if you have a prescription and you're on a Medicare or Medicare Replacement Plan, and you have expensive medications, you know you're going to cap out at $2,000, give Medicare a call, give your plan a call, and get set up on this prescription payment plan. I really think it's going to help. So there you go. Food for thought.